Let's simplify POCUS reporting. If you want clean documentation and clear communication, your report needs to be structured and complete. And here's what actually matters. Every POCUS report should include 4 core elements. The patient identification with 2 identifiers, for example, John Smith, MRN 123456. It's got to include medical necessity, why the study was performed. For example, evaluation of shortness of breath to assess for pulmonary edema, or simply shortness of breath. Findings, what you actually saw on the ultrasound. For example, diffuse B lines, no pleural effusions, or consolidation in the right base, B profile in the left base. And finally, interpretation. These elements mirror what you'd expect in a radiology report, just applied to bedside ultrasound. So this is the most important part. Your interpretation connects the findings to the clinical picture. It should go beyond just restating what you just saw. For example, findings consistent with interstitial syndrome concerning for pulmonary edema, or just pulmonary edema. This is what drives the clinical decision-making and how your report is ultimately used by others. Think about when you use a radiology report, what do you look at? Usually the interpretation first, and then the findings as necessary. A few high-yield documentation pearls. CPT codes can be included for clarity or to assist coders, but they're not required. A single report can include multiple types that are commonly performed together, for example, cardiac and lung, to simplify reporting. And if you include AI-assisted values or measurements, the independent physician interpretation must be clearly documented. And one important distinction for procedures, ultrasound guidance does not require a separate report, can be documented directly in the procedure note as long as the use of ultrasound is clearly described and commensurate with the requirements for the CPT code. For example, ultrasound guidance used real-time needle placement. Real-time means dynamic guidance, and it is what is used in the CPT code book. And as always, never forget that images must be archived for documentation. If you want to learn more about POCUS billing, visit the September 2024 Petrie POCUS blog post, 3-part series on a primer to POCUS billing, or email me, joshua.gutman@emory.edu. I'm happy to take any questions you have.